Since the pandemic hit us, there has been a deluge of new information that has been influencing our behavior and actions. We are primarily receiving this information from TV, print media, radio, social media, shared messages, and whatnot. But how accessible is this information, particularly to people with visual impairment? To understand this better, let's talk to Bhavya Shah, an incredibly talented young person who not only has some great insights on this topic, but has also contributed to making information accessible to people with visual impairment by producing a sound based graph that explains the flattening of the curve. Bhavya became blind in class 5. Since then, he has learned skills and software such as screen readers that enable him to access computers, smartphones, and all the electronic information independently. But an important question we need to ask ourselves as providers of such information is that are we doing a good enough job of making COVID related information accessible to blind and partially sighted people? Well, let's hear Bhavya's thoughts on this and more. Hi Bhavya, welcome to the interview. How have you been?
I've been good. Thank you so much for having me.
That's our pleasure. Let's start with knowing you a little. Who is Bhavya?
My name is Bhavya Shah. I am 19. I'm currently in Mumbai, but I will soon be moving to Stanford, California, wherein I will be
Oh,
pursuing my undergraduate studies at Stanford University. And I will likely be majoring in either mathematics or computer science. Other than that, I am a bit of a geek. Of course, like everybody else, enjoy listening to music sometimes, occasionally watch web series and movies, and otherwise read about issues and code and all of that fun stuff.
thanks, Bhavya. Lovely to know about you. And Stanford is a great achievement. Congratulations.
Thank you.
Bhavya, through our discussion today, I would like to learn how accessible has the communication about COVID 19 been for people with vision impairments. With this pandemic affecting our lives, every day we learn either new stats or new science about the disease or the prevention. How have you been accessing all the information so far?
I have been slightly more proactive than the average individual in seeking out such information. So, in the
Okay.
instance that one source has been inaccessible, I have looked for alternatives. This could take many forms. For instance, I started just with tracking coronavirus stats on worldometer.info, and some of the data there wasn't accessible, such as the day to day changes that were indicated as graphs, which were not described or sonified. Therefore, the alternative there was that Google itself shows day by day increments in confirmed coronavirus cases as part of its summarized data per country segmented by region. So I utilized that to get a more granular sense of this. But otherwise, if there were concepts pertaining to the pandemic, such as what the curve meant in the context of the pandemic and what the public health strategy was, what the experts were saying, then I just looked for news articles. Sometimes I had to read multiple in order to understand a concept accessibly because of the nature of the information being so graphical and image based in very many places, and the internet not describing many of their graphs and figures. But at the end of the day, I think seeking out information from multiple credible places, and during the pandemic there wasn't an scarcity of COVID related information. I think I was able to develop a sufficiently clear sense of the public health situation.
Well, you have been really thorough with acquiring information. I would like to go in more detail about sonification of graphs. But before that, Bhavya, were graphs the major challenge when it comes to accessibility? Were there any other obstacles that you came across?
This was certainly the primary one, though by no means the only one. And let me explain this slightly further.
Sure.
As a blind person, I use a screen reading software as a piece of assistive technology. It is just a software on the computer that reads out text that is on screen. Unfortunately, it is unable to describe images. So think about it this way: you have a coronavirus chart which has an x axis indicating some measure, a y axis indicating some measure, and then there is a curve on it that goes up, down, parabolically, linearly, and that indicates the trajectory of the virus in a certain set of measures. And that can be very useful information for someone wanting to get a deeper understanding of the pandemic. But those changes in trajectory, that curve, that graph, the contents of the x and y axes, those need to be explicitly described in text or need to have some alternate supplementary audio sonification, in the absence of which a screen reader would just call it a graphic. A graphic, like any other, it could well be an image of a cat that is cute for me. So, not gaining access to that information created the biggest gap, I think, for blind and visually impaired people in the pandemic. But beyond that, it's the usual. Websites can be hit and miss. Some sources are just fundamentally really tricky to use with a screen reader. But most of the times, you are able to find something that works for you. I would also note that several blind people stepped up to the task. So I don't quite remember the names of these individuals or the solutions they created, but I know, for instance, a couple people just created a more textually simplistic and screen reader friendly alternative to worldometer.info, and that got quite shared and popular in the blindness community in the height of the pandemic, wherein they would just fetch all of the stats from the original source but present it in a much cleaner table. So those are some things that blind people did to work around the accessibility challenges, but also to tackle them head on.
That's quite informative. Definitely shows that ways do exist to make information available in a more inclusive manner. We just need the will and awareness. What about the language used to describe the science or the statistics? Any views on that?
On a slight deviation from accessibility in the strict sense of being such that people can interpret and access your information, to accessibility being more about inclusiveness, I think there was a significant concern throughout the pandemic, not perhaps in the blindness community in particular, but specifically among the disability community subsection of immunocompromised people, wherein articles and journalists and science communicators seem to downplay the virus or characterize the extent of its spread by saying that it was just going to affect immunocompromised people, immunodeficient people were the ones at highest risk to it, almost phrasing it such that they were disposable and dispensable and inevitable effects of the pandemic, and that they were the only people who needed to worry about it, and since it only affected them, the virus didn't matter all that much. I think that rhetoric can be quite harmful in that it sidelines and dehumanizes people with immunity related conditions, and I think science communicators should be much more mindful of the way their language can impact and devalue different groups of people.
I second. Language plays a crucial role, when it comes to effective communication. Keeping this in mind, what more do you think can be done towards accessibility?
I think apart from that, communicators have done a decent job, though not perfect. I would have much higher expectations of particularly the more prominent data sources such as World Health Organization and Worldometer and the Center for Disease Control. And it is not clear to me that they did as good of a job as they had the capacity or resources or awareness to do, in terms of being more mindful about describing images, offering the information in multiple formats, and just actively reaching out to the disability community on their part. Because there is one aspect of just making the information that you're releasing accessible, but then there is another of actively targeting a certain group of people and trying to ensure that they reach the information that you're trying to propagate. And I think that was critical in this context, particularly because people with disabilities are more prone to medical complications as a result of the virus. So they are in greatest need of the latest public health guidance. And the absence of that, I think, probably made quite a negative difference in several people's lives.
Great point raised. Definitely. Actively targeting and reaching out would be really useful. Bhavya, what about YouTube videos? Like, those that have animations or similar ways of representation and that talk about vaccines, antibodies, and various other scientific aspects around the virus and the COVID 19 disease.
Right. I encourage media creators to look into what is called audio description. And simply put, it is just that there is a narrator who, in the moments of that multimedia content, wherein it does not in and of itself have some meaningful audio, such as somebody saying something, in those gaps, the audio description narrator would just describe what is going on, what just went on, what is about to happen in the video. So that could be as simple as, for instance, if mutation is being explained and the discovery of a new COVID strain is being shared, then giving a sense of what it means to have that spiky protein and what the structure broadly is. I know there was a very interesting visualization of how it is that COVID spreads from person to person through the particles that come out of their mouth in substantial quantities, even with a mask. And I think that would also have been quite fascinating for me to understand and engage with directly were it audio described. So that is something more people should be more conscious about.
Bhavya, you also have made a video, right? That is the purpose of which is to help people with vision impairments understand what it means to flatten the curve. Can you tell us about that? What inspired you? How did you make it? And why did you make it?
Right. So I think part of the inspiration was my own personal understanding of what it was that was trickier to access and what I felt fewer people in the blindness community understood in regards to the pandemic. And one of the things that I identified was that the concept of flattening the curve was widely talked about in the press, in the media, in the public conscience. However, it wasn't clear to me that many blind people knew what that curve actually represented and what flattening it entailed, and therefore were unaware of the implications of the strategies in terms of what flattening the curve actually achieved. So, the way I tried to address that in my own little way is that I created a 10-15 minute explainer video in which I harnessed the power of audiographing and sonification technology, which is just to say that when you have a graph, if you go from left to right, all that's happening is that you are moving a certain direction in the x coordinate and a certain direction in the y coordinate. So if you represent the changes in the x coordinate with the audio moving stereophonically left to right, and if you represent changes in the y coordinate with how pitchy the sound is, then you can actually orally convey the entirety of the graph quite simply. So it would just be sound going from left to right, going up and down in terms of pitch based on how the graph is moving. So I utilized that to give an auditory sense of what the curve was, and then I explained using latest public health guidance and science based knowledge what it meant to flatten it. And I hope that that would be of use to several blind people in getting clarity on what was being talked about.
And I've engaged with that YouTube media that you've created, and it's really good. It's very well explained, and that clearly shows that if you really want to do something, every information can be, uh, delivered in a way that includes different sections of the society. So that's really great work, Bhavya.
Thank you.
Now, there are three preventive measures that we are asked to follow, right? Washing hands, wearing a mask, and social distancing.
Hmm.
And apart from these, there is like the navigation in the public spaces has changed, to avoid crowds. And adapting to these measures have taken some time for everyone. Like, we are not used to of wearing a mask, and avoiding crowds is was difficult in overpopulated cities. So it was difficult. Did you personally face any specific challenges in adapting to any of these?
I think social distancing is the trickiest one because blind people do rely on shorelines and tactile cues, and it's not always possible to foresee where the people in your proximity are located, and as a consequence be able to maintain that 2 meter or 6 foot distance from them. So what that often causes is that blind people are unable to maintain social distancing as strictly as they should be, and hence my understanding is that during the pandemic were more homebound than usual, but to the extent that they did go out, it was trickier to follow that guidance. So social distancing posed its own challenges. I'm not sure if I'm in a capacity to offer structural solutions to that, but it's just an issue that not very many people are aware of and perhaps could be thinking about. Washing hands is perfectly all right, and wearing masks, personally for me, it wasn't a challenge at all, but I could see why some other blind people would find masks to be an impediment in gaining the non visual perceptory information about their surroundings through hearing or through smell, because a mask is a little bit of an intermediary barrier in that. So, there definitely were troubles associated with these. Not to say that blind people should be exempted from following them, but just that these are considerations that more people should have.
Those are really useful lines to think about, Bhavya, that policymakers and decision makers can take point of. And, you know, a pandemic can come again, or any other healthcare problem can come again, and we might be required to, take such preventive measures again. And if we can think about how we can make these more inclusive for people with different disabilities, that could be really useful. Thank you for sharing your experience with us. Bhavya, as a young person, you are the future of the country. How do you think we can build a better tomorrow in terms of healthcare?
I think the biggest solution would be to start caring about healthcare. It just isn't a voting issue. It's not something that is on the top of mind of many people. And I think citizens are far too often distracted by issues that don't directly impact them and perhaps even divide society. It would be far more useful if we could build that public will and political capital as a result around healthcare, so that healthcare becomes something that is actively being talked about, that people want to see improved, and that when the next pandemic comes around, we aren't resorting to retroactive band-aid style measures, but have a system that is strong and ready and capable.
Thank you, Bhavya. Thank you so much. I hope that we see that future soon. I learned so much from this interview. Thank you for uh, taking your time for this interview and joining us. And I would like to say that I'm very impressed by how much you keep yourself informed. And we need the zeal in the youth of our country. And I hope together we all can build a better tomorrow, a better future, where we are more equipped to face any global issue that comes. to us. So thank you so much, Bhavya.
For sure. I also wanted to commend Planet Devok 91 on what you guys are doing. So great job and keep that up. And thank you so much for having me today.
Thank you so much, Bhavya. Well, that's the end of this enlightening chat with Mr. Bhavya Shah. My name is Sonal Katyal, and this interview has been produced as a part of Planet Dialogue 91, an international participatory webcomics project. Supported by DBT Wellcome Trust India Alliance, Manchester University, NHS Foundation Trust, Wow Bagger Productions, Interfer South Africa, Royal Society of Chemistry, Science and Technology Facilities Council UK, National Institute for Health Research UK, Blastfest, Welcome Education, and the UK Academy of Medical Sciences. A special thank you to Dr. Sarah Heather Iqbal, who has been an invaluable part of this project. And a big thank you to Dr. Sam Taraporewala, Director of the Xavier's Resource Center for the Visually Challenged, Mumbai, India, for helping me reach out to a lovely group of people for this interview series. Thanks again to Mr. Bhavya Shah for sharing his inspiring work to make COVID-related information accessible for people with visual impairments. Don't forget to check out the other two discussions on accessible communication during the pandemic using the links in the description of this video. Thank you for listening. Take care and stay safe.